Look at this question here, asked in anatomy final theory exam paper, recent years. The end artery is present in which of the following organs? So please read this. They're talking about end arteries here. What do you mean by end artery? That means if it gets blocked, there is no other blood supply. So if this is an artery and from this you have some branches coming, and from this one further you have a branch coming, and from here you have another branch coming. Now let us say these two have anastomosed. Okay, there's an anastomosis between these two. But now look at this one. Let us say there's a blockage here. Okay, so this guy is gone, dhamar. Why? Because he has no anastomose. But now let us say this guy, okay, this guy here, he has a blockage here. This guy is not going to die. Why? Because the blood is going to come via the anastomose and this guy will still be fine. So basically what you're seeing here, this is a end artery. It does not have any anastomose. So once it gets blocked, there is no blood supply. So what is end artery? Arteries which do not anastomose with their neighbors are called end arteries. The examples are the retina that is in your eye and ear. Okay, remember eye and ear, you have some end arteries. These are the best examples for absolute end arteries. Then you have some things in the brain also, and vasa recta of mesenteric arteries, that is in your abdomen also. Okay, then arteries of spleen, kidney, lungs, metaphysis of long bones also are end arteries. So you should be very careful about these arteries, right? Injury to these, etc. So basically now here you answer the question, end artery is present in which of the following organ? Intestine, stomach, spleen, testis. What did you read? I told you spleen, correct? I told you abdomen, mesenteric things I told you. So testis we didn't tell you. Okay. So basically retina, ear are best examples that they did not give us in the options. Cerebral arteries, mesenteric arteries, they didn't tell you. Spleen, kidney, lungs, metaphysis of long bones. So here we are choosing the answer is spleen. Okay. In the options, they have given spleen. Fine. So why is this important? If there is any occlusion of the end artery, there will be serious nutritional disturbances causing the death of the tissue supplied by it. That is what death of tissue is, infarction. So if there is occlusion of the central artery of retina, then it will result in what? Blindness. Yes. Okay. So central artery of retina is coming from ophthalmic artery, internal carotid artery, ophthalmic artery that is supplying your retina. So you got this. End artery is present in spleen. You can say in this. The best option they should have given you is retina actually.